Good afternoon and welcome to Let's Chat. I'm your host, Dr. Celeste Reese-Willis. I'm your board-certified family medicine physician. I help busy professionals to find solutions to their medical needs through my concierge medicine program, virtual medicine program. In addition to that, I'm a national speaker as well as to a recent Amazon best-selling author with my brand new book, Vitality. Good afternoon, everybody. Hi, Dr. Monica. Hi, Dr. Mashika. Thanks so much for joining us. Hi, Dr. Janine. Thank you for joining. If you're out there and joining us, please say hello so that we can acknowledge you. We have a few things to share with you today. Just a couple of things. It's going to be a really quick live, hopefully, today. Many of you know and probably have seen that our governor, we live here in the state of Alabama, and our governor, Kay Ivey, has made an announcement today that she will be lifting the Safer at Home order starting on Monday. Hi, Celeste. Thanks so much for joining. Hi, Miss McClure. Hi, Miss Sandra. How are you? Thank you guys so much for taking time out to join us. Hi, Miss Donjan. Thanks so much for joining us today. So, and my voice may sound a little scratchy today. We were outside in the rain this morning doing some COVID testing and got a chance to touch some lives. So excited and happy about that. But just wanted to come on and share with you guys today. Hi, Miss Black. Thank you so much for joining. Just wanted to share with you guys today and wanted to kind of share with you a little bit about what the order is. And so we had a stay-at-home order, which Governor Ivey had put in place on April the 30th. It was to be lifted on May the 15th. She's made an adjustment to that order today. And in that order, she details some things regarding social distancing, regarding sanitation rules, and decreased occupancy of businesses that will reopen. Now, of course, it is safer to stay at home than to go out and be out in public with other people, but we're reopening businesses. So in an effort to try and help us all with that, I thought that we would share today some things that are important for us to consider when we do leave our homes. Now, on the announcement today with Governor Kay Ivey, the state health officer, Dr. Harris, did confirm that that the state of Alabama is seeing an increase in the number of cases in the last couple of weeks, but we're not sure if that's due to testing or actually an increase in disease, as we know that people can present and be asymptomatic and have COVID-19. So some of the things that are going to be really important, and Dr. Harris spoke about that today, is doing contact tracing and isolation. So I thought that I would share with you guys today what exactly that means, and we talk about the mask situation a little bit, and then I'm going to share with you about what I did today and what I'm so excited about. So the contact tracing and isolation is important because what that does, it'll identify individuals who've been around people that have found to be positive of COVID-19. And so because you have been around someone that's positive for COVID-19, and we've done a number of tests this week on patients, both inside the urgent care and even with my own personal COVID site, with people who have been in contact with someone that was positive with COVID-19. So what that means is if you've been in contact, we generally will test you and we'll say, hey, you need to stay in until you have a negative test result, or if your test comes back positive, or quarantine for 14 days. That is what most employers are requiring of their employees. And so what I'd like to do is ask you guys to make sure that you follow these guidelines. It's so important. The contact tracing and isolation is so important to help take care of all of us as a community and make sure that we collectively as a community mitigate the risk of spread of COVID-19, especially as businesses are being reopened. I can't tell you how important that is. So if you speak with your doctor and they say, hey, you know what? I need you to quarantine for 14 days, or I need you to stay in until that test result comes back negative, it's really important that we follow that, because by doing that, because we know that you've been exposed to someone that's positive, we want to make sure that you stay in until we know that you're negative. And I know that you may not be exhibiting symptoms, and I know that I've talked to numbers of people that are personal friends, patients, business owners, etc., that have different and varying frustrations about the situation. And you know what? I'm right there with you. This is a very challenging situation and time. There are a lot of emotions. There's a lot of stress, a lot of anxiety. that's going on just on both sides of the fence with this, and in particular, definitely for our frontline workers, those emergency room physicians, nurses, lab techs, respiratory therapists. We give it up to them every day, and we appreciate all of their hard work because they definitely are putting their lives on the line. But so in an effort to mitigate the risk of spread, we need to help protect these people. And so but what we can do to help protect them is things like, if you know that you're positive or you've been exposed, let's stay in to decrease the risk that we'll get it. And if we decrease the risk that you get it, then we decrease the likelihood you'll have a complication, or it'll be complicated enough that you have to visit an emergency room or a hospital. Everyone that's positive for COVID-19, I had this question earlier this week from someone that suggested that everyone, if someone comes back positive, don't most of those people go to the hospital? And in actuality, no, most people don't go to the hospital. Those severe cases do. But because this is such a lethal virus, we're just trying to do everything we can to mitigate the risk of spread. And guess what? We all have to work together for that to happen, both as a household, as a community. We've got to do that. So I wanted to caution our medically challenged community with the relaxation of the guidelines and the reopening of businesses. A couple things have happened. First, they've removed the 10-person limit. And that starts Monday at 5 p.m., which means that we'll be able to go to church services, but there'll be a requirement for people maintaining a 6 feet distance between anyone that's not in your household. Now, that is so important, and I can tell you that I understand the challenge. I can tell you that even today, I saw some of my girlfriends today and wanted to hug them and wanted to love on them. And guess what? I could not do that. As much as I wanted to, I could not do that because I have to maintain that 6 feet distance unless I'm coming in for a few minutes or so to look at something, listen to something of that nature. And so I understand that challenge. Mother's Day is on Monday. I want to see my mom. I want to hug my mom. I want to express all kinds of things to my mom. But because I love my mom so much, and because she definitely is a part of the challenge I've shared with you before, that she's been challenged with heart disease before that reason, loving her means staying away from her, staying 6 feet away from her. And so this is probably first Mother's Day, and I don't know how long that I won't be able to see her. But that's me loving her, is staying away from her. So I definitely want to encourage our and I call them our medically challenged community because it's a health challenge. And then when I say that, I mean people that have heart disease, people that have diabetes, people that have any kind of chronic lung condition, chronic kidney condition, anyone with any kind of health challenge. You want to make sure that you are aware of the risk as you go out and make sure that you take measures to protect yourself if you have to go out. So that means maintaining that 6 feet distance is so important. I can't tell you how important that is. They are opening up restaurants and bars, and they're having them open by you have to have a 6 feet separation between tables. So nothing wrong with hey, how you guys doing over there? You can send your love in that way and loving on them and staying 6 feet away from them. So I can't tell you how important that is. So I want to encourage you guys to keep your when you leave your home, keep your mask up. Give me 6 feet. Remember that you definitely are safer at home. You are safer at home because you are decreasing the likelihood you'll interact with other people outside of your household. Now, this is also an important time wherein washing your hands is so important. When I was a little girl, my mom used to tell me, oh, you guys need to wash your hands when you come in. Me and my brothers and sisters, it was 5 of us growing up. We would go out, play kickball, hopscotch, all those kinds of things. And she would tell us to wash our hands before dinner. Now, I'm sure that a lot of you out there have the same advice from your mom, right? Because moms give great advice, right? Right. Well, this is a time that we're going to have to take our mother's advice and take it to heart. We want to make sure we're washing our hands and just make this a part of your normal persona. Before you eat, every time before you eat, please wash your hands. Again, the entry points of COVID-19 are the eyes, the nose, the mouth. Those are the main entry points, right? So you want to make sure that you have clean hands before you eat, because when we eat, we eat different things. Some things we eat with our hands, and we want to make sure that we haven't been out somewhere and touched a doorknob or door handle or car door handle or something like that, and you don't want to put that virus into your mouth. So we want to make sure you wash our hands before eating. I would make it a habit to, the minute you get home, I would take my clothes off, put them in the washing machine or wherever it is that you launder your clothing. I would make it a point to wash my hands. You want to make sure you drop your shoes off at the door. You don't want to track wherever you've been walking all day into your home, in and around your home. Having a little box at the door where you put your shoes. I know that some people have had like a little area that they put their shoes in. Some people, spray it with Lysol. Some will use, if you don't have Lysol, because Lysol is in very high demand right now, having a little thing of water or something with just a little cap full of Clorox and dishwashing liquid or something, or soap, and letting the bottom of your shoes be washed or cleaned so that you don't track it throughout the house, or either just leaving your shoes at the door. So making a habit of washing your hands very frequently. Washing your hands before you eat, wash your hands when you return home, making sure you take off your clothes of the day. If you're someone that's out, especially with things opening up as you're out all day, once you get home, the first thing you want to make it a point to do, hey, let's change my clothes, whether that's putting them in the wash, laundering them, and getting on fresh clothes to be at home. Making sure that you make a conscious effort not to touch your eyes, your nose, or your mouth if you can help it. If you wear glasses, please make sure you clean the rims of your glasses frequently. Please make sure you clean your AirPods, ear pieces, headbands, anything that we kind of don't think about, because we're on the cell phone and everything is technology and handless. And so you just want to make sure that you're cleaning these items frequently, because as you're going throughout the day, I know that I do, when I am out and about, frequently have my AirPods in, I'm talking, I'm always multitasking. Everyone that knows me knows that. And making sure that I clean those on a regular basis is so important. So we have to guard our health and be very proactive and be kind of vigilant at this moment with businesses reopening. Again, you definitely are safer at home. But if you have to go out, and especially if you have to work, please make sure that you take these precautions. It's going to take us as a community to do that, to mitigate the risk of spread of this disease. So now let's see if anyone has any questions. And so, I forgot to share this. So I was going to share with you guys what I did today. So, and some of you may have seen it on social media, but we were able to start doing some rapid antibody COVID-19 testing. And we're being hosted by Skin and Wellness Center, offices of Dr. Corey Hartman. Shout out to them for hosting us with this particular effort. And what we've done are just trying to screen some people and find out and make sure that they're not positive, and giving them some reassurance about how they need to proceed according to what's specific for them. When we do our COVID testing, we do assess each individual patient individually, and it's more than just a test, it's an assessment to take your history, find out what symptoms you have, do a little more detailed. I am a detailed oriented kind of person, and trying to help provide some recommendations and advice to you. We are testing people that may not necessarily be my patient. You may have a physician already. There are some physicians that aren't necessarily doing the COVID testing. There's a shortage of PPE, and we've been blessed enough that we have the PPE to be able to properly evaluate people and keep us safe and help keep you safe while we do so. And so we're very blessed to have that opportunity. So if you're someone that's interested in that testing, we do have secondary nasal swabs and PCR testing as forms of confirmation that we send off, but those tests take a few days, but we're able to give you a result within 15 minutes, which is something confirmed by sending off another swab. So we're excited to be able to provide that service to the Birmingham community. Very, very excited, and to be a part of helping to assess the patients and people of this community, and helping to safely have us reopen and populate with one another, shall I say, but we hope that everyone will do so in a safe manner, which means we want to keep that mask up, especially just because you have your mask up doesn't mean that you should come within that 6 feet. And if, you're someone that's like, sometimes you have a challenge saying, oh, well, how far is 6 feet? It's just 2 arms length. You want to make sure that person is at least 2 arms length away from you. So I encourage you guys to do that. Again, mask up, give me 6 feet. You're safer at home. Let's wash our hands, especially before we eat. Anyone have any questions? I see that my mom is watching. Hey, Mom, hope things are okay. And I see that Ai is watching. That's my sis, who made the beautiful mask that we were able to wear. Thank you so much, sis. Hi, Miss Tate. Hey, Miss Bryant. Thank you so much for joining. Yes, and that's Celeste. She was there too. We were talking earlier, Ai, about how we saw one another, but we're still keeping 6 feet because we love each other, but we're going to keep each other safe by staying 6 feet away from each other. As much as we used to laugh and joke around before, and not being able to do that is a challenge, but unfortunately right now that's kind of what we have to do. Hey, Miss Taylor, thank you so much for watching from Montgomery. Okay, so Dr. Janine asked a great question. She asked, should people get tested prior to going back to work? Absolutely. For several reasons. Main reason is, and a lot of people just want peace of mind to know, hey, do I have it? Have I been exposed? This is something to be concerned about. It helps to give peace of mind. It helps us find out, okay, these are the people that have tested negative. They're doing well. So then okay, if I know that I'm negative, then I know to, at least at this point that you're negative, to mask up and take all the precautions, and you can proceed with the safer peace of mind, knowing that the likelihood that you have the virus is very, very minimal because your tests have been negative. And again, there's not 100% test that's out there at this moment, but the tests that we have, and each round as companies are developing these tests, each round gets more and more specific and more sensitive. And this is kind of how it goes when a virus first comes on the scene. It's not, the flu virus has been around, we know, at least since 1918, probably over 100 and something years. And so we have a very, 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 straightforward way of knowing how to treat the flu, how to detect the flu, and decrease the risk of spread of the flu. We have vaccines. We've had vaccines for years that know how to do that. So there's a lot of immunity that goes on with the flu. Well, guess what? They had to start somewhere. So this is a novel coronavirus, so it's new. And so we're just starting it. So we're having to develop a vaccine, and that typically is something that can take up to 18 months to develop. So that's what we have there. So that definitely, thanks, Dr. Jenny. That was a great question. Okay, so let's see. Dr. Mishik asked a question. Should you have the same type of test done after 14 days, swab versus antibody? So my answer to that would be, it depends on your exposure. It depends on what the risk factors are. Different people have different risk factors. For healthcare workers, we're going to look at that in a different filter than we would look at someone who's outside of healthcare and knowing what their exposure is. For someone that has a lot of chronic medical conditions, a heart patient, someone that has diabetes, we're going to look at their things a little bit differently than we would someone else. So we'd have to assess that on an individual basis. But I will tell you this, there have been a few of the patients definitely that I've taken care of, both through telemedicine and in direct contact, that have had a combination of both. I've seen people have swab, then antibody. I've seen people have antibody, swab. So I've seen a combination of things. And to be quite honest with you, all I can tell you is that the more information that we do have, the better it is. We're better able to assess what's going on with you and knowing, okay, this is a person that it's okay to repopulate you with the general population, and that it's decreased likelihood that you pose any risk to anyone. Hey, Miss Garris, thank you so much for watching. Hi, Mr. Harbin. Hey, Tiffany, that's my cousin Tiffany. She probably remembers that reference to the hopscotch we used to play when we were kids, and how our mom, when we would come in, our moms would say, hey, you got to wash your hands. So we need to remember our mom's advice right now and just make that a part of our DNA and something that we do on a regular basis. So Okay, let's see. Someone else is asking a question. Let's see. Miss Tate is asking, how much is the testing? So the consultation and rapid antibody test is $125, and then the reflex test that's sent off to the laboratory is something that's sent off and billed to your insurance. So that's how we're doing that. Let's see. Oh, Miss Garris, thank you so much. I'm so happy that the information is helpful for you. And then Celeste is saying, yeah, a lot better peace of mind and knowing where you stand in terms of, hey, have I been exposed, and whether or not you're having symptoms. Because I do understand that it can be unsettling, and it's an unsettling thing, but the only thing that we can do is practice what we know. And the two biggest weapons, again, the biggest weapon, you'll always hear me say that, in the fight against COVID-19 is that social distancing. So even if you're out, because I've been out and people haven't necessarily been practicing it, but I'll say in a minute, hey, give me 6 feet. You can make a joke about it. It doesn't have to be a tense situation. I just wanted to, but part of the motivation for today were a couple of articles that are just disturbing things that we're seeing in the news regarding the first article I read today was about Costco and how there are so many people that are upset because Costco is requiring people to wear a mask when they come into their store. And I say big ups to Costco for being proactive and trying to decrease the risk of spread of COVID-19. Big ups to Aisha Jones, who's listening now, who she's reopened her store and has a mandate that when you come into your store, you have to be masked. And they're providing gloves so that there's no, all of these things are measures that help to decrease the risk of spread of COVID-19. So they're not doing it in an effort to be difficult or harsh. We're trying to save lives. We're trying to help people. We're trying to decrease the risk. The last thing you want is for one of the workers in this situation, because you have to remember that every store that you go into, everybody has a different past medical history. And right now, loving people means wearing that mask, because when you wear the mask, you're protecting other people from you. When they wear the mask, they're helping to protect you from them. And when you don't wear it, you're putting those people that are out there. Everyone has a different past medical history. And it doesn't matter if it's a person that's not, an older person that's, 70, 80 years old, that people would see, you look at a person and you say, okay, this may be someone that has some chronic things going on. Well, guess what? There are younger people that have autoimmune conditions, that have heart disease, that have diabetes, that have different things. And this particular virus serves as a risk to them. So what we all can do to help decrease the risk is everybody mask up. Everybody give me 6 feet. If everybody does that, we decrease the risk of spread of this virus. And again, big ups to those businesses that are being very proactive and saying, hey, you know what? I want people to feel safe. I want them to feel more relaxed when they come into my store, and knowing that, hey, we're trying to help decrease the risk of spread. We're following the sanitation measures. It's a great thing when you walk into the grocery store and you see that they're wiping things down and making conscientious efforts, to follow the guidelines that are put in place both by the CDC and us for here in the state of Alabama. I know that our mayor put forth an order for people to wear masks. I think that is awesome. I think that is great. I think that is something that's being proactive and helping to try and decrease the risk of spread. I think that if you're out somewhere, I think you should respect whatever entity, whatever business it is that says, hey, we'd like you to wear a mask before you come into our store, before you come into this area. I think that we should respect them and do that. We should not get angry. We should not fight them on it. It's a temporary measure for whatever 15 minutes or 10 minutes or 30 minutes that you're in that space. You're going to wear that mask. And when you do that, you're going to love on the community when you do it. And it is imperative that we all do that as a community and as a city and as a state and as a nation to help decrease the risk of spread of COVID-19 and help save lives. It's not just about, and while definitely the healthcare workers are putting their lives on the line, so this is one way that you can give back and love on them and show them out of respect for them putting their lives on the line for you and to help keep us safe and to help keep us all healthy, I think it's a testament to say, hey, you know what? Out of respect for them, I'm going to wear this mask because I know that means that if I have it, that means I'm decreasing the likelihood that Miss Jones, who's in the store with me, who's 50 years old, who may have diabetes or heart disease, who could easily pick this up from me so that she doesn't get sick and have to go to the hospital and therefore put another physician, another nurse practitioner, another lab tech, another x-ray tech to put their lives at risk to help treat someone that has COVID-19. We definitely take our job seriously and we take an oath to do this. It's why we were put here. We're put here to serve in terms of medicine, and we take an oath as a physician to do that. And that's definitely something that I take very seriously. I was called to do what I'm doing, and I will continue to do it as long as I'm here. And as long as God wants me to do it, I will do that. But I just ask for you, out of respect, myself and other healthcare workers, that you please follow these guidelines and that we not give in to what Satan wants us to in terms of anger and bitterness and hatred and malice and some of the disturbing things that have just been seen over the last several days have just been just horrific and disgusting, to be quite honest. But I do feel that love wins and love is stronger. And part of us loving each other and as a community, and we need each other. I need you and you need me. And I think it's important for us to remember that and for us to follow that and help each other get through this time because, you know, we need each other. And we can do so in fun and in laughter and in love. That's a whole lot better than malice and anger and hatred and things that will lead you to a place that in the end that you definitely don't want to be. And again, yes. And I think somebody already put it in the chat. Yes, love always wins. Love that, Tiffany Hargett. Thank you so much for sharing that. So, hey, Michelle Burke, thank you so much for watching. So, and again, Dr. Janine reminded us, COVID does not discriminate. COVID definitely does not discriminate. It doesn't care, what your age is. I could go on, and I'm a long-winded person. Haha. But this is just something that I just want to impress upon you, how important it is that we come together at a time like this and love on each other instead of choosing that other road that leads to things that are not of God and are not the things that He wants us to do. And so with that, ladies and gentlemen, I want to remind you, mask up, give me 6 feet, you're safer at home, wash your hands. And for anyone that wants to be tested for COVID-19, my website, it's drceleste19.com. That's DRCELESTE C19.com. You can make an appointment. We're going to be there Mondays, Thursdays, and Fridays from at least 8 to 12 for right now. If you have any questions, please leave them in the chat. We will be coming to you on Sunday. I know it's Mother's Day, but it's going to be a fun kind of topic, hopefully, that you'll find interesting and hopefully really, really short. But happy Mother's Day to all you mothers that are out there that are listening. Happy Mother's Day. Love on your mother. Loving on your mother right now may mean staying 6 feet away from her, but that's what we need to do. That's what I'm going to do with my mom, whom I love so much, because I really, really want to hug her. You have no idea how much I want to, but I can't do that because loving her means staying away from her right now. So that's what I'm going to do, and I encourage you to do the same. Thanks so much, guys, for joining us today. Have a happy rest of the weekend. Happy Mother's Day, and we will come back to you live on Sunday with great information, hopefully, and something that's helpful. If this information has been helpful to you and you're watching it in replay, please do me a favor and put #replay in the comment section. If you're listening to this information, you feel like it could be helpful for anyone, please share it with them. And I just encourage everybody to just love on each other. And Dr. Janina saying, get tested. Definitely so. So with that, ladies and gentlemen, have a good Friday night, rest of the weekend, and we'll see you on Sunday. Have a good day. Bye-bye.